Get right into it as we speak to Nehawu President. Babu, thank you so much for joining us. One of the issues that you are fighting for, first and foremost, as you are going to that Thursday protest or demonstrations, is the issue of the health workers in communities, health workers that are on the ground. But just give us a sense of what is it exactly that you will be demanding on Thursday.
We demand that health community workers must be absorbed by government. That the decision taken in a conference of the ANC and the manifesto of the African National Congress must be implemented. Yes, because that debate in the conference came as a result of the national health insurance, the importance of health workers and the importance of primary health care. Yeah. Therefore, it is our view that that decision and that resolution must be implemented.
But you speak about the health workers being absorbed, in fact, those that are community-based. And in fact, there was in 2016 a judgment by a labor court saying that that must actually happen. Why is it that after so long you're still fighting for the same thing? Could it be that you haven't been doing the groundwork to actually ensure that that particular decision is then implemented?
The moment that there's a judgment, it's no longer mutual interest in a labor law terms is a right. That's why we are surprised with the government pulling its feet and dragging its feet in actually implementing that decision. If you continuously giving someone contract, you are by way implying the necessity of that person's service. And by law, you are creating what is named reasonable expectation. But we cannot continue in South Africa making people secondary and making people work without future. Because when you wake up in the morning, you do so in order to make sure that you are able to serve your children. Question of benefit, pension, medical aid, all of those things goes along with the permanent employees. And that's what we're demanding for community health workers, because we think that those workers are doing a most important, even more than those that are already in the hospital.
Well, President, the issue of the fact that that decision was in 2016 and you are still surprised about it is actually one to be concerned with, because you are the ones that are the watchdogs making sure that the workers get what they deserve. But let's move on to this.
There are many things that we are surprised.
But you can't be surprised, President, when it happened in 2016. In 2020, you are then saying that you are surprised and you are supporting health workers that were supposed to be absorbed in 2016. Exactly. How are you surprised today?
Not the reason we are surprised. We're surprised that when people are talking, they're talking things that in the end they're doing completely something different. When you entrust someone with power, you expect that person to exercise that power on your interests. But that's not what the government of the African National Congress does.
It hasn't been doing that since 2016, President. It's 2020. Why haven't we seen this type of action then?
It's not easy to go on strike. You know that there are many elements in a strike.
Surely they don't take 3 years, President.
No, it's not. There are many issues. We have been engaged in different discussion, in different platforms, including the PSCPC. And each and every time when we raise this thing, nobody denies that there are such decisions. But the question that becomes a problem is implementation. That's why, finally, we think that the only option is to go on straight.
We're losing time, President. We'll leave it there for now. But one more thing about the issues that have been highlighted. We had a focus yesterday, the health workers. It seems that as we're seeing a possible second wave, there's still not a readiness in some of the facilities, such as Eastern Cape. What is your call there?
As it did when we were calling during the first wave of coronavirus, we are again. We thought that the first wave have taught us a lot of things. We thought that the little space we had, we should have been prepared. Again, we are surprised that as if this thing is the first time that is coming, that has been there before. In any way, the things that were exposed by coronavirus are things that we've been telling government all along. Yes.
All right, President. For now, let's leave it there. In the interest of time, we'll continue offline with that particular conversation. But Jeremy, one of the words that is coming out is a surprise, in which they're saying that government hasn't been able to live up to many of the things it committed itself, including that judgment of the Labour Court in 2016, when they said that health workers in the communities should actually be absorbed by. But this particular protest seeks to address exactly that decision that was taken in 2016. But the word of the day, I guess, is that the Nehawu is surprised.
All right, Lindokuhle, thank you very much indeed. Live for us in Kempton Park.